Hello everyone, welcome to sqadia.com, and in the second section of our lecture we will talk about the management and treatment. So the treatment of the menopause can be hormone replacement therapy or it can be non-hormone therapy. So we will talk about both these types of therapies used for the menopause. So management of menopause can be divided into two. One is prevention and then the counseling. Counseling is important after menopause because of so many different changes, pathophysiological changes in different organs of the body, and it affects the psychological functioning of the female also. So counseling sometimes help to relieve with those problems. And prevention is divided into two types of menopause. One is spontaneous menopause, which is the normal, naturally occurring menopause that occur naturally, and then the artificial menopause, which is not the natural menopause or the spontaneous menopause. Treatment is non-hormonal treatment, and then we have hormone replacement treatment of the menopause. In non-hormonal treatment, different things can be tried. If they can get any benefit, then female can keep using those remedies. So different things can try, like lifestyle modification is important. Change in lifestyle pattern, sleeping pattern, eating patterns, exercise, regular exercise, sleeping on time. These some changes which you can make in your normal routine life is sometimes very helpful in managing the symptoms of the menopause. The nutritious diet is also very important. Make sure you should have regular healthy meals and do not, eat junk food, but nutritious diet is very effective for the non-hormonal therapy of the menopause. Supplementary calcium is effective for the bone problems to treat it's effective for osteoporosis also. So supplementary calcium should also be taken with the menopause. Regular exercise help to strengthen the bones, muscles, and also help you sleep better. So exercise is very effective for the treatment of the menopause. Vitamin D is also very important for the development of the bones, and it is for the deposition of the calcium also. And sunlight is very effective source of the vitamin D. So going out and doing exercise in the sun and taking vitamin D supplements are also very effective. Smoking and alcohol. Stop smoking and drinking alcohol. That helps in the treatment. And bisphosphonates are effective. Fluoride is also effective to reduce some symptoms. Calcitonin is used to enhance the calcium absorption. Then estrogen and receptor modulators are used. So selective estrogen receptor modulators are tried to help the symptoms of the menopause. Clonidine, thiazide, these are the different antihypertensive drugs. Thiazide is a water pill, so it helps decrease the blood pressure, but it also helps decrease the feeling of bloating and the heaviness. And then there is paroxetine, gabapentin. These are the drugs to help the patient psychologically. And then phytoestrogen and soy protein. So these are some non-hormonal treatment remedies. Some of these can be tried, and if they are effective, patients should continue using them. Then hormone replacement therapy for the treatment of the menopause. What's the indication, or what are some conditions under which we should use the hormone replacement therapy? One is if the symptoms of the menopause are very serious, or if they are really disturbing the social life of the patient, then it's better to start the hormone replacement therapy, so to relieve the menopausal symptoms. And prevention of osteoporosis it's good to use the hormone therapy to maintain the quality of life. So as I mentioned, if the symptoms are severe or if they are affecting the quality of the life of the patient, to improve that quality of life, it is better to use the hormone therapy. And then some special conditions in which hormone therapy should be prescribed is premature ovarian failure, because ovaries are not functioning normally, so hormone therapy is important. Gonadal dysgenesis and surgical or radiation menopause. If the surgery or menopause is after due to surgery, if hysterectomy is done or ovaries are removed or radiation therapy is used, then those kind of menopause, usually abnormal menopause, can be treated by the hormone replacement therapy. So hormone replacement therapy and osteoporosis. This diagram here gives you the idea how important it is that for the deposition of calcium in the bone, these hormones are. So if there is a healthy bone cell, if there is no menopause, before menopause, with the help of hormones, estrogen and progesterone, especially estrogen, minerals, calcium and phosphorus, all those are deposited in the bone. So hormones help in the deposition of minerals in the bone, in the healthy bone cell. So when the levels of hormone are low here, after menopause, there are low hormone levels. So low hormone levels, what causes the minerals leaks out of the cell. The calcium goes out of the cell. So the bone become very weak as a result of the leakage of the minerals out of the cell. And once the hormones are replaced, when the hormones are given by replacement therapy, an increased level of hormones causes increased deposition of minerals again on the bone, and it helps treat the osteoporosis. So estrogen level are very, very effective for the deposition of minerals on the bone, and when the levels are decreased after menopause, usually they cause osteoporosis or the weakening of the bone. Now, some risk of hormone replacement therapy. There are benefits of the hormone replacement therapy with the treatment of the symptoms of postmenopause or menopause, but there are risks also of the use of hormone replacement therapy. And some of the risk of hormone replacement therapy is it can lead to endometrial carcinoma. Endometrium is the lining of the uterus. So with the hormone therapy, endometrial cancer is common. Breast cancer is common. There is venous thromboembolic disease, thromboembolism. Thrombosis form, clots are formed in the blood vessels with this hormone replacement therapy. There is chances of heart diseases, coronary heart disease. Lipid metabolism is affected. There is increased level of cholesterol there. Dementia or memory loss is there common, and Alzheimer's disease is common, in which there is dementia or forgetfulness or memory loss. So all these are very common side effects of the hormone replacement therapy. Some risk factors for the heart problems here mentioned. Hypertension, high blood pressure is very common risk factor for cardiovascular diseases. Increased lipid level impaired glucose tolerance tests, smoking. These are 4 very common factors that leads to heart problems. Then common factors that leads to osteoporosis is family history, age is common. Osteoporosis is very common in Asian white race. Its lack of estrogen cause is osteoporosis. That's why it's common after menopause. And then decreased intake of calcium and vitamin D cause osteoporosis. Drugs like heparin, steroids, gonadotropin releasing hormone analog can cause osteoporosis. And then some diseases like thyroid, hyperparathyroidism, malabsorption, and multiple myeloma. All these can cause osteoporosis. So these are the risk factors for developing osteoporosis besides low estrogen which occurs in the menopause. So it can be dietary, certain drugs cause, certain diseases cause osteoporosis, age effect is there also, and body weight is also affect the osteoporosis. With high weight, obese people usually have more chances of getting osteoporosis. Then available common preparations for hormone replacement therapy. We have oral estrogen available for hormone replacement. Then we have combined estrogen and progesterone available in cyclic pattern, estrogen and cyclic progesterone, and combined estrogen and progesterone are available. These are all so only estrogen, combined estrogen and progesterone, and they are available in the form of patch, implants, vaginal creams available. So all these different forms of hormones are available. Hormonal therapies are available for the treatment of menopause. And then other is LNG, IUS, levonorgestrel, intrauterine system, intrauterally in uterine insertion of progesterone, levonorgestrel, and this is available in the form of known as tibulon. Tibulon is used for intrauterine insertion for the relief of menopausal symptoms. So these are all the preparations available for the treatment of the menopause. The duration of the use of hormone therapy is important. We cannot use it forever. Usually 3 to 5 years of hormone replacement therapy is good enough. Once slowly the symptoms start improving, we should stop or reduce the dose of the hormone replacement therapy as soon as possible, and we should use the low dose hormone replacement therapy. So 5 years is the maximum time in which you can use the maximum dose of hormone replacement therapy. So that was all about the management and treatment of the menopause, and we discussed in detail about the non-hormone treatment and the hormone replacement treatment for the menopause. Thank you for watching sqadia.com.